The Ministry of Health and Medical Services is in the process of reviewing two key pieces of legislation, the Health Administrative Act and the Nursing Council Act. Elisa Kukutu with the details.
The Ministry of Health and Medical Services is reviewing its Health Administrative Act and the Nursing Council Act. Minister Dr. Paul Bosawai told Parliament that a policy document has been drafted for the Health Administrative Act, which will be presented to Cabinet this year. He said a desk review has also been completed for the Nursing Council Act.
In terms of our legislative programs, mifala go ahead for wakalo samfala acts where hemi important for driving now ministry forward, and one now hemi Health Administrative Act and the Nursing Council Act. With him, with the partnership and stakeholders, Ministry and Bara work hard for good for review now this Health Service Act Amendment 1998 and Act, Mr. Speaker, this Act and Bara were overdue and outdated. Already a policy document is being drafted and will be presented to Cabinet next year or the first quarter of next year, 2025. The Nursing Council Act also in progress. We will start with them drafting this nursing policy. Desk review, Mr. Speaker, has also been done and completed, and the ministry now has developing policy, which Bahami also submitted to Cabinet next year, 2025.
Minister Bosawai adds that the ministry is also developing a health workforce strategy aimed at strengthening the ministry's workforce.
Solomon Islands' skilled health workforce density is among the lowest among the Pacific Island countries, with a triple burden of chronic skilled health workforce shortages, inequitable distribution of the workforce, and insufficient workforce to meet the SDG health targets by 2030. Noting and recognizing the importance of health workforce in the healthcare system, the ministry have now in draft of a health workforce strategy 2024 to 2031, which we hope to finalize this in the first quarter of next year and present it to Cabinet for its endorsement and blessing in 2025. The strategy will move Ministry of Health and Medical Services, Mr. Speaker, forward for a stronger health workforce and ensuring that we have a fit-for-purpose workforce and forecasting for the future workforce against various diseases developed in the health sectors, against the new diseases that might come up, and also the reimaging of what are all sickness where you may experience it.
Elisa Kukutu for SIBC TV.